Abby.
Hi.
My name is Jessica. I'm a student nurse, and I see that you've been recently diagnosed with type 1 diabetes, correct?
Mm-hmm.
Okay, well today I'm going to teach you a little bit about signs and symptoms of hyperglycemia and hypoglycemia.
Okay.
Do you know what hyperglycemia is?
High blood sugar.
Okay, and so obviously hypo would be
Low.
okay. So you know a little bit, right? But you don't know signs and symptoms?
No.
No? Okay. Well, that's what I'm here for. So today, we're going to learn about hyperglycemia. So basically what it is, it's like you said, it's high blood sugar. Okay, some symptoms, or the cause of this is like if you've had too much food and you haven't like maybe injected yourself enough with enough insulin, or it could be caused by illness. When you're sick, your blood sugar will go high, or even stress causes your sugar levels to go high. Okay, so and it usually starts off kind of slow, so you may not feel the symptoms right away, but it could lead to a medical emergency, so you kind of need to look out for the signs. So what you might experience with hyperglycemia is you're going to have extreme thirst. You're going to probably, because you have to drink a lot, you probably will have to pee a lot, okay? So you may also have dry skin. You might feel a little itchy, dry skin. Also, another symptom could be hunger. You feel absolutely hungry, Your vision could also be affected. And you might feel a little sleepy. You'll maybe notice that you'll have some wounds, like say you scratch yourself and stuff, and you're not healing properly. Okay, so if your sugar levels are too high, you're gonna want to have to call your healthcare provider, your doctor. Okay, and he'll recommend maybe if you're on a sliding scale, how much insulin to inject, or maybe what food to lay off. Okay. Do you happen to know normal blood sugar levels?
No.
No? Okay, well normal blood sugar levels it should be between 70 and 110, okay? And so anything above 110 is considered hyperglycemia, okay? So, like I said, a way to treat this would be maybe you would have to give yourself a couple of units of insulin according to your sliding scale. Or if it doesn't resolve, you're going to have to call your doctor. Okay? Mm-hmm. All right. Now, we're going to talk a little bit about hypoglycemia. And you said it was low blood sugar. Okay, the cause of this is too little food, or like maybe you've skipped a meal. You've skipped a meal before, right? Breakfast or lunch, Mm-hmm. Okay. Or it could be that you have too much insulin. You gave yourself too much insulin and not enough food to counterbalance it, okay? It could also be because maybe you haven't had enough food in your body and you're exercising. Are you an athlete?
Uh-huh.
Yes? Okay. So you might want to check your blood sugar before, during, and after you participate in any sort of activity, okay? Because activity can also cause your blood sugar to go down. You may need to alter that with a snack, okay? So some signs and symptoms of hypoglycemia are you might start to feel shaky. Have you ever felt shaky before? Like when you're super hungry, haven't eaten all day, and you're just like, you feel a little bit shaky?
Yes.
Okay, that would be a symptom. You might feel like your heart is racing, like it's just pounding out of your chest. You may also be sweaty, may feel a little dizzy. You might feel like you're having an anxiety attack if when your sugar starts to go low. Another symptom could also be that you're hungry. Some of these, you may also have weakness or fatigue. You're going to feel tired, you're going to have a headache, you're going to feel very irritable, okay? This one, the onset come on suddenly. Like you'll feel these like bam. Okay? The way to what you want to do is check your blood sugar, okay, to see where it is. And we said normal was 70 to 110, correct?
Mhm.
Well, if it falls below 70, you're going to want to check the simplest way to treat this hypoglycemia is to either drink half a can of soda or half a glass of orange juice. That's the quickest way to get your blood sugar back up. You also might want to carry glucose tabs. They sell them like in the pharmacy. They're little. They look like candies, but they're called glucose tabs, and they raise your blood sugar. Or you might want to keep hard candies in your pocket at all times. Okay. So after 15 minutes, after you've treated yourself with, like, say, half a can of soda, you're going to want to check yourself again. Make sure it's, within normal limits. If you're still kind of low, you're going to want to maybe drink a little bit more. Or you could also add, like, a graham cracker with peanut butter on it, or half a peanut butter sandwich. So it'll raise your blood glucose a little bit. Okay?
Mhm.
So, okay. Do you have any questions at this point?
No.
No? Okay. Well, could you tell me a couple of symptoms of hyperglycemia?
Drowsy, hunger,
Okay.
thirsty,
Okay.
having to urinate a lot.
Okay. Good job. And how would you treat this hyperglycemia? You've had too much food, maybe not enough insulin. You'd want to check your sliding scale, right? Okay, and then see where you fall. Like, for both of them, you're going to check both your blood sugar, okay? And depending on what your doctor has told you, you'll go by your sliding scale, inject yourself with whatever amount of insulin is on the sliding scale. And if that doesn't work, you want to be sure that you call your doctor, always, okay?
Okay.
What about hypoglycemia? What are some symptoms of hypoglycemia?
Being shaky,
Okay.
fatigue,
Okay.
hungry.
Yeah. Most definitely. Okay. So, what could be... Now, is this onset sudden, or does it creep up on you? It happens suddenly, Okay? So just think of, like, anything that causes your blood sugar to go low, which would be like activity. You haven't had enough to eat. You'll feel the effects right away. Okay?
Okay.
And always check your blood sugar, okay? And if, like, say for example, if you have hypoglycemia, say like you're feeling the symptoms, but you don't have your glucose monitor, just go ahead and treat yourself. Like, go ahead and have that half a can of Coke or half a cup of juice, because you're starting to feel shaky and stuff. And if you don't treat it, you could pass out. Okay. And then we'll have bigger problems by then, okay?
Okay.
So, do you have any questions for me?
No.
No? Okay. Well, I'm going to go ahead and give you these papers. You can go ahead and put them on your fridge, so that way, it'll be there as a constant reminder. Well, not a constant reminder, but, so it'll help you remember. And before you know it, you won't need these papers anymore.
Okay.
All right?
Mhm.
All right.
All right.
Well, thank you.
You.